We've got lots of employment services where we support people to either go into work or to keep their job. And we found that quite naturally people were slightly anxious about still looking for employment at a time when COVID was unfortunately being transmitted quite significantly. We had a lot of our client group who asked us, can we carry on and have some support in the form of wellbeing calls, and we realised that actually there were a number of people who hadn't got those kind of social networks or had any other contact with anyone else, and sometimes lived alone, that really did benefit from having someone keep in touch with them. We had the opportunity of applying for some NHS Charities Together money. So many of us, I think, will have seen lots of promotion at the time about Sir Captain Tom, who raised over £100 million for the NHS. So we actually wrote a bid to look at how we can support tackling loneliness and social isolation through that grant. We were lucky enough to obviously be successful in that. For us, it was very much about appreciating the impact that loneliness has on our health and well-being. So from our point of view, we obviously wanted to be able to support people within our communities to be able to have those social connections and have those networks really where they have someone that they can talk to. We understand that loneliness, although it can affect all of us and does affect all of us, even sometimes when we are in work, we know that it will actually have possibly a greater impact on people who have been disproportionately impacted by the pandemic. So whether it be our ethnic minority communities or whether it be individuals that have lots of complex barriers or need support from services such as what we would provide as a trust. And we know how much having people around you can support recovery.
And how we started out was initially we made lots of contacts and networks across the Black Country. We linked in with existing partnerships, steering groups across the Black Country. And this, in a very short time, there was a massive demand. Lots of referrals started coming through. So we knew there was a massive demand. So we then put out for a volunteer to come and join us as well. Our volunteer is with us now, and she's now in paid work on the project. We also have a Kickstart placement with us, who's here with us for 6 months, supporting us, who developed really, really well. So we have 3 staff members at the moment supporting us on the loneliness project across the Black Country. As part of this, we realised very, very quickly there was a really big demand from different services. So Public Health got in touch with us as they were really keen to know what we delivered and whether we could actually reach out to people of other languages and whether we could support this group. And I know loneliness has been ongoing way before COVID, but I suppose it came to light during COVID, and we realised how much of a gap there was, how much of a need there was. Lots and lots of people, as you're aware, are really afraid after COVID to be able to come out the houses, engage in group learning, come out for walks. And some of the developments will be that we will now, these group sessions which we delivered virtually through COVID, we're going to deliver these at different venues across the Black Country face to face to try and get people out, engage with each other. Some of the successes would be that we've identified lots of different things where actually when we talk to people who are lonely, there's other barriers existing with those, and it can be some of their physical health condition, mental health conditions. It can be actually people might not have enough food, but it's never actually been raised before. They've not had that rapport with anybody to talk to on a weekly basis to be able to open up with. We have to ensure that people are safe, people are fed, and obviously that contributes to their well-being and keeping well as well.
Hi everyone, I'm Ruby and I'm a loneliness vocational support worker. I'm just going to talk through some of the activities we do on Let's Talk. So at the moment, virtually, we've got our coffee and quiz mornings. So we do them every couple of weeks. So we have our coffee morning every other Wednesday. And on those, we kind of touch on loads of different topics. We have people come in and present for us. So in the past, we've done things like mindfulness. We've done stuff like talked about our favourite things. We've had people come in and talk about Diabetes UK. We've had people from gyms come in and do stuff on health talks. We've had all sorts. We kind of vary them as much as possible, and we try and take on. We do like surveys and try and take on our clients' ideas as well, and try and cater it around what they want as well. And our quizzes as well. We have every other Thursday. My colleague Maddie usually puts together the quiz. We usually like 50 questions, just a bit of fun. We do it every couple of weeks as well. So as well as that, we do our walks. We try and cover it across the whole of the Black Country area. So at the moment, we've got the West Park walk in Wolverhampton, which is every Monday 2 till 3. We've got our walk in Walsall Arboretum. Again, that is 11 till 12, sorry. And then we're starting off a walk in Sandwell and Dudley. So the Sandwell one is in Dartmouth Park and the Dudley one's in Priory Park, which are to be confirmed, the times and days. It's just a little walk and talk group. We have a bit of an amble around the park with our clients. It's a nice way for them to kind of see us face to face and have an amble around in the fresh air. And it kind of encourages them to get out and, I suppose, build networks with the ones who are on the walks. We are kind of hoping to start doing more face-to-face coffee mornings as well. We're looking at venues that we can look into. And yeah, hopefully be expanding more face-to-face as well.
Hi, I'm Maddie. I joined the Let's Talk team around 2-3 months ago as a Kickstarter, and I'm really enjoying it so far. It's very rewarding being able to help others and kind of combat loneliness. I'm the first point of contact for people when they want to be referred into the service. So we will get referrals from maybe outside organisations or self-referrals, and they will come in and I will contact them first and see what steps we can take from there. Just say you're interested, maybe tell us a bit about what you want. So, for example, Ruby's talked about the walks and the coffee mornings. If those are interesting to you, that's brilliant. We can get you onto those pretty quickly. But if you have something else in mind, we can signpost you to a different service in the area, or maybe look into volunteering or social group activities. It's anything that you want, really. It's tailored to you. Make sure to get in contact if it sounds interesting, and we can get you signed up and ready to go.
We are very proud of the work that we've done so far in the Let's Talk project, but we certainly see it as the start of this process and of this activity. We are committed to supporting people from lots of different groups. Obviously, with the right resource, we understand that we could reach much wider to a number of our different communities. And from our perspective, we would like to carry on this project and this service so that we can support far more people than what we've done so far in our journey.